Good afternoon, and thanks for joining us for Living Local, your lifestyle show for everything Charleston. I'm Ashley Meservey.
Medical Monday, sponsored by East Cooper Medical Center.
So today we're talking about a very important subject when it comes to new parents or even people who have already had children and are expecting another one. We're talking about unsafe sleep environments, which research shows is the #1 cause of death in infants.
Yes. Safe sleep environments are very important to think about. Some of the causes of issues when it comes to having good safe practices when it comes to sleeping with your baby is to make sure that you're room sharing and not bed sharing. Bed sharing can lead to a lot of complications, especially when there's excess blankets, pillows, other adults sleeping in the bed. So it's very important not to also have your children sleeping with other siblings, because children are 5 times more likely to have sleep deaths related to sleeping with a sibling. Yeah. So we want to make sure that we're teaching our families the most important ways to sleep safely with their children, and it's having their own sleep environment.
So what does a safe sleep environment look like?
A safe sleep environment is an environment where the child is sleeping on their own. It would include a very firm mattress, nothing that has a lot of excess blankets or cushiony bedding in the bed. It would be an environment that doesn't have bumper pads, because bumper pads are a strangulation or an entrapment hazard which would cause suffocation in a child. We do see a lot of parents make the mistake of having stuffed animals in the beds. Those are also issues that can cause suffocation, so we want to make sure that they keep only the baby in either a onesie, a pajama, or in a swaddle sack like the one that's shown here. That is a more safe environment for them to be in.
So all those Pinterest pictures and stuff, we need to just throw those out.
Oh yeah.
Because we've all seen those. Where, I mean, it looks amazing, but I'm sure it's just full of bad news in there.
Yeah. So we see a lot of the photography that is on the social media now, where they have the babies that are sleeping on their stomachs, which sleeping on your stomach is one of the leading causes of death for children for SIDS. And we also see them lying in very cushy baskets and things like that, but that gives the parents a false sense of security and safety for their children. So we want to make sure that they know that these are just for show, and that's not a safe sleeping environment. You really need to have them in an environment with nothing around them that's firm and not soft things around that they can suffocate in. Also, too, parents make the mistake of dressing their children very warmly, so they think that the babies need to be a lot warmer than us, but they should be dressing them just like you would be dressing in a normal environment, because overheating also causes unsafe sleep issues.
And I guess if you had all that other stuff in there, it would make it even worse.
Yeah.
Well, you said, I thought it was interesting that sleeping on your stomach, do you think the common misconception is that if they were to, as far as like burp or throw up or whatever, that they would already be on their stomach?
Yeah, there's a lot of people who feel like spitting up is one of the reasons why they want to put them on their stomach, and it sometimes is a cultural issue, but back to sleep is always the most safe practice that they can get into.
And I know we touched on this a little bit, but what are some of the things that parents need to think about when they're planning for their baby's safe sleep environment?
I think the one mistake that a lot of parents make is thinking that an unsafe sleep situation can't happen to them. It can happen to anybody. It happens 26 out of 100,000 births. So, it is far more common than we really think about. And they also need to be thinking about anything that's around their baby that could be a suffocation hazard.
Okay.
Also, sleeping in a chair or sleeping on a couch. They really need to be cautious of that, because when you relax, your baby can fall into wedged areas like in between the cushions, and they can be suffocated, or they could even fall out on the floor and hurt themselves.
And so what type of things is East Cooper doing to promote this, educate the public on what a safe sleep environment is, so that you don't have more incidents where parents have, unfortunately, a devastating thing happen to their family?
Well, I think it's mostly that we're role modeling what the safe sleep environment looks like. So we're doing constant education and doing that on immediate reaction to make sure that we're catching those families and talking to them about what the safe sleep environment looks like if we catch them with stuffed animals or pillows or lots of blankets in the bed. So it's role modeling.
Okay, and where would you recommend for more information on this?
There is some great sites called Cribs for Kids, and Cribs for Kids has a lot of information on what a safe sleep environment looks like. There is also the National Institute for Health that also provides a lot of information on what a safe sleep environment is.
Okay, and so would you say at the end of the day, when in doubt, less is more when it comes to...
That's exactly correct. Less is more, and it's something that we always have to provide safety information on, and we want our families, when they go home, to mimic what we do in the hospital. So role modeling is important.
And also feel confident when they go home.
Yeah.
All righty, well, thank you so much.
Thank you. I appreciate it.